Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts as your guides. I'm Melissa Horitzik. We have a lot of health news you can use in this month's episode, including what's causing your aches and pains. A local orthopedic surgeon explains what causes arthritis and the treatments available locally to alleviate discomfort. We'll look at the causes of acid reflux, the symptoms to look for, and why you don't want to ignore them. And this Mount Dora couple has shared 52 years of marriage and open heart surgeries. Stay tuned for their story and meet the doctor who they credit with giving them more years together. First, a Lake County employer is part of a larger organization that has received national recognition as a great place to work. Adventist Health System, the parent company of Florida Hospital Waterman, has been named a Becker's Hospital Review's 2017 list of 150 great places to work in healthcare. The distinction recognizes organizations for their commitment to fulfilling missions, creating outstanding cultures, and offering competitive benefits to their employees. Florida Hospital Waterman has more than 1,700 employees out of the 80,000 employed by Adventist Health System in 45 hospital campuses across 9 states. Meanwhile, the Tavares Hospital's electronic medical record system has captured international attention. Recently, a delegation of IT health professionals from Denmark toured Florida Hospital Waterman to learn about the implementation and benefits of their technology. The hospital is one of the region's only adult hospitals to achieve HIMSS Level 7 designation for electronic health record keeping. It is the highest adaptation of health electronic records and has led to a predominantly paperless patient record environment, which helps improve quality and patient safety. Visit fhwaterman.com to learn more about the hospital's efforts to improve patient care. In our next story, a Mount Dora couple is grateful for the life-saving care they received at a local hospital. In fact, after seeing the care his wife received, the husband insisted he be transferred to Florida Hospital Waterman when it was his turn.
I had a mild stroke, and I did not know a stroke. So wait until later on, I went to see a doctor, and doctor referred me. I don't feel anything at all. I don't know, I have a heart attack or whatever, but I don't feel until the day I operate, the doctor operate me. He just explained to me that have to be done, otherwise we'll be later on in trouble. So I say, okay.
As you might imagine, the ones without symptoms are the hardest ones to figure out.
Cardiothoracic surgeon Gary Allen performed open heart surgery on Ann Riley.
There's the chest pain that somebody's holding onto their chest and they're having this terrible pain. But that only occurs about half the time, and in women even less so. So women tend to have atypical presentation.
About 6 months after his wife's open heart surgery, Al Riley faced a similar health crisis.
Well, I do my routine checkups, see the cardiologist and my primary on a regular basis. And on that weekend, I had biked 60 miles. On Monday, I went to see my cardiologist, and they did an EKG and freaked out. And so they took me to Orlando, where they did a heart catheter and realized that I needed a quadruple bypass and a valve. Of course, I asked to be transferred back here because I wanted to see Dr. Allen. Because one thing, he has a family plan, and we wanted to take advantage of it.
Riley did transfer to Florida Hospital Waterman, where Dr. Allen performed the surgery. Like his wife, Riley was surprised to learn of his life-threatening condition.
I never had any symptom. I could drive 60 or 80 miles, and my recovery was within minutes. No symptoms at all. They told me I could fall over on the bike trail at any time, which was a scary thought because it could have damaged my bicycle.
The Rileys, who have been married 52 years, are recovering well and taking extra steps to be healthier. They both subscribe to Dr. Allen's advice.
Pretty much anyone after the age of 40 needs to be into some type of what I would call maintenance program. So they need to see their regular primary care doctor, even if they have no symptoms at all, to start to do what we call risk stratification. Because like most things in medicine, When we become reactive to the problem, the patients don't do as well as when we become proactive to the problem.
You'll find many resources for you and your loved ones by visiting fhwatermanheart.com, and you can even test your heart health. Experts agree that meeting with a primary care provider on a regular basis can be critical to a person's health.
Most people will say, especially when you are young, before your 40s perhaps, or before your 50s, say, I am in good health, I have no symptoms, and will defer going to the doctor for even an annual physical or a checkup. When in reality, it's perhaps one of the simplest things to do to make sure that you are well. Everyone wishes you're healthy. You would, but not everyone has that luck.
Dr. Chang says an annual exam or physical is how primary care doctors learn about a patient's health and potential future issues.
You go through asking a series of questions. First, whatever the patient feels free to say. It's pretty much, I am okay. I am coming to see if I am healthy as I think I am. There are some factors that play a role in diseases that you may not think are significant. The older you get, the more likely you have high blood pressure, for example. The likelihood of you having a problem goes up with age, and there is nothing you can do about that, but you can cut on all the other risk factors that you may have that you don't know about or you don't think about. Oh yes, being overweight, being obese is a problem. Smoking is a problem, but that's not me. Depending on the individual, you present a certain risk and you try to tell them, this is the risk that you have, a risk for either a stroke or heart disease or diabetes.
Dr. Chang says knowing a patient's health history as well as his or her family history is what makes a primary care physician so instrumental.
You create a relationship and you know how that person is going to respond. Sometimes you can figure out how that person is going to age, and you learn to deal with that, and you adapt a treatment or a plan to that person.
Inspired to find a primary care physician to help you and your family? You'll find one at the website on your screen. Next, we turn to a disease that affects approximately 20% of the U.S. population, according to experts. Gastroesophageal reflux disease, also known as acid reflux, most often affects adults.
Basically what happens is the stomach makes the acid, and if the acid is too much, or when the sphincter which controls the reflux of the acid into the esophagus gets weak, the acid goes into the esophagus and irritates, causes symptoms. The symptoms could be due to the burning sensation, and sometimes it causes spasm of the muscles, causes chest pain, it mimics like heart attack, and sometimes when they have a bad acid reflux, it spills into the mouth, oral cavity, then they have a bad breath, and sometimes it causes the asthma, breathing problems.
I started having trouble with being real tired and a lot of reflux and just sickish. And so I went to my doctor 2 or 3 times and had all kinds of tests, and she didn't find nothing. And so she sent me to him. Well, he did the tube down the throat, the endoscopy. I had all kinds of tests like x-ray of my liver and stomach and stuff. And then he found the GERD.
Dr. Bhaskar says there are different treatment options, but the first step is lifestyle modification.
I tell them to stop taking too much of caffeine, chocolate, wine, spicy, rich foods, because all these foods increase the acid reflux. If you're obese, that also increases the risk of acid reflux, so I'll tell them try to lose the weight. Other most important thing is the lifestyle modification, is how they eat. Usually I'll tell them not to have a late dinner. Then I'll also tell them not to go to bed immediately after dinner, at least for a few hours.
Dr. Bhaskar says there are effective medications that can help control the symptoms. Some of them are over the counter.
If they're able to control with the symptoms, usually how I do is I'll give them for 4 to 6 weeks time, and I'll tell them about the lifestyle modification also. Then I'll tell them to take it as needed basis.
It's not really, really bad. Sometimes I have it more than others, but like I said, if I watch and don't just keep eating when I feel like I've better stop, then it's usually pretty good.
Dr. Bhaskar says laparoscopic surgery is a viable option for some patients.
It's a minimally invasive surgery, and the patient can go home on the same day on most of the time. And it's very effective, and especially I recommend the surgery for young patients who needs the medications almost every day, which affects the lifestyle. The other one will benefit more from surgery.
Visit the website fhwaterman.com to find a specialist who can help you and your loved ones with your digestive health. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A Tavares orthopedic surgeon discusses advances in joint replacement surgery that could help alleviate arthritis pain. You may think twice before walking out the door wearing flip-flops. Stay tuned to learn from a local podiatrist. And you'll learn how to make something perfect for picnics when we visit the Con Recreation Health Center kitchen. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, you or a loved one might want to check out these upcoming events. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Horitzik. Many people experience aches and pain in the joints at one time or another, but when the discomfort is constant, it could be a sign of arthritis. Waterman Wellness spoke with a local expert about arthritis and how it's treated.
The definition really of arthritis is loss of cartilage. And cartilage is that white shiny stuff you see on the end of a chicken leg or ham bone. My grandma used to call it gristle. And gristle is articular cartilage, and that's like a Teflon coating that coats the ends of all the joints in our bodies. The problem, the human body does not reproduce gristle. It's got to last a lifetime. And when we're young, it's thick. As we get older and we put more miles on our bodies, it tends to wear out and thin out. So it's a hereditary thing. And of course, the most common kind of arthritis we see in our country is osteoarthritis, which is wear and tear arthritis. Unfortunately, with people, as we get older, and there's a lot of baby boomers now, and our joints are wearing out, and so joint replacement is going to continue to be a very necessary procedure in the future for a while. High impact stuff, really, running is not great for your knees, because any consistent high impact stuff has the potential of wearing down that gristle, that articular cartilage. Really, a brisk walk is better for you than a high impact run. Swimming is better for you as far as cardio, as far as your flexibility, but my philosophy is you got to be active, you got to stay active, you got to exercise, you got to do things. Being sedentary is not good for any of us. And if you like jogging and triathlons and any of that stuff, then go do it. I'd rather you do that and worry about the consequences down the road.
Dr. Radnothy says advanced joint replacement procedures are available in Lake County for patients who need joint pain relief.
When somebody does decide, though, that they need to have surgery, I think they need to look at the surgeon and see what the surgeon's experience is. And I think that when you look at hospitals, you have to look at the ratings of these hospitals and ask around. I would put Florida Hospital Waterman, as far as a joint replacement orthopedic hospital, right up there with the best of them from anywhere. That's a pretty good testimony to the folks that work at Florida Hospital Waterman and the whole medical team.
Florida Hospital Waterman is the first in Lake County to earn a Joint Commission certified Gold Seal of Approval for knee and hip replacement. You'll find more information about the Florida Hospital Waterman Joint Replacement Center by visiting fhwatermanortho.com. Here in Central Florida, flip-flops are a fashion fixture. But is it a good idea to wear them? Waterman Wellness checked with a Lake County expert.
The typical flat flip-flops are bad for you. because your feet have a normal anatomic medial arch. You're stressing that muscle and those tendons.
Dr. Balcaran says it is possible to enjoy the comfort and convenience of these cool slip-ons.
These are the flip-flops that I like and I have here in the office. It moves and it supports your medial arch, your natural anatomic arch. So when you stand up, your foot is aligned with your knees, your hips, your back, your shoulders. When you stand up with the other flip-flop, you're flattening down and your knees go in, your hips go in, your back goes out, and you're not supported. If you buy a dollar store flip-flop, you're going to get a dollar store pain. You have to invest the money to buy the right stuff for your feet because your feet are worth it.
You can find a specialist to help you put your best foot forward by visiting the website on your screen. Next, for many, this is the time for family gatherings. What can you bring to help with the meal? We visit the Con Recreation Health Center kitchen now, where Chef Dave has a great side dish recipe. This time of year, the weather is perfect for a picnic, and today I am joined by Florida Hospital Waterman Executive Chef David Atkinson and registered dietitian Peter Weiss. Peter, do you have a recipe today that's perfect to take along?
Yes, we have a Dijon roasted potato salad. We're using mustard instead of mayonnaise. While we are using a little bit of mayonnaise as well, we're going to be using a vegan mayonnaise, and that vegan mayonnaise will help to lower the cholesterol that's in the overall potato salad.
Sounds delicious. Can you tell us the ingredients that go into this, Dave?
Sure. We've roasted some red potatoes in the oven for about 30 minutes, diced them up and tossed them in a little bit of olive oil, salt and pepper. We have pepper, blackening seasoning, chopped parsley, hard-cooked eggs, chopped rosemary, red onions, Dijon mustard, chopped celery, and the vegan mayonnaise. Couldn't be any easier. We're just gonna toss it all together.
Dave, sometimes people are concerned about bringing a dish with mayonnaise in it to a picnic.
Yeah, most commercial mayonnaises have so much acidity to them that it's not really much of a problem anymore. It doesn't really allow the bacteria to grow the way it used to.
Okay, well that's good to know.
So another benefit of using the mustard along with the mayonnaise and being able to cut down on mayonnaise a little bit is that it's going to lower the fat content of the potato salad. It's going to be a very heart-healthy product to have at a picnic.
And that's it, really.
What would you say a serving size of the potato salad would be?
For this salad, about 4 ounces is a good serving.
If you'd like to give this recipe a try, you can find it at watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the May episode right here on Lake Sumter TV for some of the following stories. Stroke Awareness Month is coming up. A local expert has important information you should know about detecting the onset of a stroke. A Tavares pediatrician will have advice for parents on how to adapt to your child's diagnosis of food allergies. And how about a serving of apple pie in a glass? We'll head back to the Con Recreation Health Center kitchen for a smoothie recipe that's delicious and good for your muscles. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Alyssa Hritzik for the award-winning Waterman Wellness.